Hello and welcome to Prosopon channel. My name is Nancy and in this channel we explore interesting topics around psychology. Today we will be talking about mindfulness-based therapy or else MBT. At the end of this episode you will have the opportunity to practice a mindfulness-based exercise with me, so make sure everyone that you stay until the end. But first let's have a look at its origins and how someone can be mindful. It needs to be highlighted that mindfulness-based therapy, even though it is based on meditation and Buddhist philosophy, it is not related to religion. The founding father of mindfulness-based therapy is Jon Kabat-Zinn, an American professor emeritus of medicine. In one of his talks in UC Berkeley's Greater Good Science Center, he talked about the Chinese symbol of mindfulness and its meaning. I have referenced the symbol in the description below, and as you can see, the top half of the symbol means presence and the bottom means heart. Therefore, Jon Kabat-Zinn explained that when thinking about mindfulness, it's important to know that we're talking about presence of the heart. Our lives, especially nowadays, are so busy. Sometimes we do things automatically and we're not really present. Similarly with our thoughts, we might think about our past or future, but sometimes it's hard to stay in the present moment. So, the purpose of the mindful practice is to pay attention in the present moment, be not just mentally aware. One of the basic but so important practices of mindfulness-based therapy is to observe our breathing. It might sound easy, but for someone who hasn't practiced meditation, they might notice that their mind wanders. That's of course something normal and, to be honest, something that we cannot avoid. However, in mindfulness-based therapy, the goal is to notice our thoughts, not avoid them. Notice them and then let them go. Then gently bring our attention back to the breathing. Other daily exercises that someone can practice mindfulness is by paying attention to their walking, sitting, eating, drawing, anything that they do, and notice their body posture, their breathing, sensations, emotions, their thoughts, everything that they experience at the present moment. Mindfulness is being practiced in mainstream and SEN schools, in prisons with a goal to improve their self-esteem, in businesses with a goal to build teamwork and take care of the employees' well-being. Mindfulness is also being practiced in hospitals as an attempt of acceptance and to lower the levels of stress in patients. As someone who works with students with learning difficulties, autism, Down syndrome and other conditions, mindfulness is also in our daily schedule. Mindfulness practice can help our students feel safe. They work towards acceptance by paying attention to their body, by being aware. Through some mindfulness exercises I have practiced over the years with a lot of my students, I have noticed an improvement in their physical skills as well as their communication too. Over the last 20 years, mindfulness meditation has been developed greatly and an array of mindfulness-based programs have evolved. Some of them are mindfulness-based cognitive therapy, mindfulness-based pain management, mindfulness relaxation, stress reduction, among others. Now, let's move into the mindfulness exercise. For this exercise, you can either sit on a chair or lie down on a bed or your sofa. What I prefer, and I know that many mindfulness practitioners do too, is to lie down on the floor. It allows a good balance to focus. But as I said, choose anything comfortable for you and you can have your eyes closed or open. After you found your position, I want you to focus on your breathing. Is it fast or is it slow? Does your breath go all the way down to your lungs or is it stay up in the chest area? Notice what comes to your mind. Any maybe worries, anxieties, or what happened earlier in your day. Notice any sounds that your room might have. Notice the sounds outside your room too. Do you hear cars or birds? Maybe people talking? Now, gently try to bring your focus back to your breathing. How is it now? Is it still fast or slow? With my lead, let's take a deep breath together. Inhale, exhale. Let's do it one more time. Inhale, exhale. Now, notice your body. Does it feel warm or does it feel cold? Bring your attention to your head, your eyebrows, your eyes and nose, cheeks, your chin. Does it feel tense anywhere? If yes, notice this tension. Focus there for a little bit. Then notice your neck and shoulders. Is there any tension in this area? Stay there for a little bit longer. Now, I want you to focus on your breathing again. Do you notice any difference? I want you to slowly move your head to the right, very gently. And then move it to the left, gently. And then bring it back to the center. When you feel ready, slowly move your fingers and then move your toes. Slowly bring your attention to where you are. Is it your bedroom, living room? And when you feel ready, you can open your eyes. If you had your eyes opened already, just look around and notice the room. Take a few moments to bring your attention back to the space. I hope you enjoyed this short mindfulness exercise. If you would like to develop this exercise on your own, you could stay in position and focus on your arms, chest, abdomen, back, groin, hips, legs and feet, in every single part of your body like a scan. Remember to always come back slowly. That was today's episode. I hope you liked it. Subscribe to my channel to make sure that you receive notifications for when a new video is out, usually every week on Mondays. I'd be more than happy to hear from you. Anything you would like me to talk about or any comments about your experience with mindfulness. See you next week, everyone. Bye.